I'm not. Hello, I'm Mykasha. I'm going to be a nurse today. Can I get your name and date of birth? Correct. Well, I'm coming in to check on you and do a assessment. You're here from a fall at home. And a GI bleed. So I just want to check on you and do an assessment on you to make sure you're okay. And because you had a fall, I want to do a neuro assessment just to make sure you're okay. Let me wash my hands and get my gloves on. All right, so we're going to start off with, I'm going to take a look into your mouth. Take a look in your ears. Can you follow my finger? Okay. Can you grab my hands? Can you push forward with your feet? I'm going to take a listen to your heart. Now listen to your lungs. Deep breath in, deep breath out. 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 Okay, I'm gonna listen to your stomach. Are you still having stomach pain? Okay. Let's see if we can do something about that. Okay, vital signs obtained. And he has an order for a central line. He has an order that it's okay to use the central line for medication and blood draws. And he is to start D 5.5 at 150 milliliters per hour. And to insert nasogastric tube to low intermediate suctioning, which while I'm getting everything prepared for his blood transfusion, I'm going to delegate that to the LPN to provide cluster care and get care provided to him faster. He is going to be NPO, and his AccuCheck is to be done every 6 hours. He has an order for heparin, which I would hold that because it's contradicting his GI bleed and will make him bleed more. And his Lasix, I'm going to call the doctor because his blood pressure is running at 98/60. So I just want to make sure that he is okay to receive the Lasix. So I'm going to question that Lasix order. He also has a ACE inhibitor, which I'm going to question as well or hold because, again, his blood pressure is 98/60. And I'm going to go ahead and set up the continuous IV infusion, which should help his blood pressure go up a little bit. And because his O2 set is at 90, it's not terrible, but it is a change. So I'm going to call the doctor and get an order for oxygen, just for precautions. Calling a doctor. Hey, doctor, get well. I have a patient who's here who is admitted for falling in the bathroom. He has a GI bleed, and we also have to do further testing for abnormal lab values. He has coughed up nausea and vomiting 150 milliliters of coffee ground emesis on the prior shift, night shift. He has an allergy to sulfur. Yes, and his primary diagnosis, like I said, is the fallen GI bleed. He has a couple orders that I want to question. I'm going to hold his heparin that was ordered because he is here for a GI bleed. And his Lasix, I want to get the go-ahead to hold that. And his ACE inhibitor, just his blood pressure is already running low. So I want to hold this dose until we can get his blood pressure up a little bit higher. Okay, thank you. Okay, I'm calling the lab to let them know I am sending down his blood sample for his type and cross. Once his type and cross is completed and back, then I will infuse his infusion of packed red blood cells. So I'm going to go ahead and get started on his D5.5 normal saline at 150 an hour, which should help him with the nausea and vomiting, because his mucosa is dry from throwing up. And he's also bleeding, so he's losing volume as well. So before I set this up, I'm going to check again. And can I get your name and date of birth? Correct? Okay. I'm going to wash my hands. Are you having any pain at the moment? No pain? Your skin color looks good. Your GI is hypoactive. Your skin color is a little pale. Your neuro is fine. You're able to give me your name, date of birth, and you know where you are. So yeah, we're gonna try to go ahead and get this set up for you at least. All right, I'm priming the line. Okay. All right, I am hanging his D1.5 normal saline at 150 milliliters per hour. Okay. I'm going to wipe down his IV. Okay, I'm going to set his flow rate of 150 milliliters per hour. Volume is going to be 500 milliliters. Okay, now that we have your pump going, I'm going to go ahead and put your oxygen on because your O2 is in the 90%, and I just want to make sure you're okay. You're having some nausea, vomiting. We're waiting on lab to give us the results for your typing screen. I'm not going to give you your blood pressure medication this morning because your blood sugar is running pretty low. I called the doctor and he gave me to go ahead to hold your Lasix. And I'm waiting on an order to get you something for that nausea and vomiting that's still bothering you. I got a report that you were still throwing up. And before I give you that blood transfusion, we're going to go ahead and get a baseline vital sign on you before we start the transfusion. So we're kind of going to be in and out. Once we start that transfusion, we're going to sit here with you for, we have to continue to check on you for at least 5 minutes. And then 15 minutes, we're just going to continue to get that vital sign on you just to make sure that you don't have the reaction. Have you had a blood transfusion before? No? Yeah, so you're going to have 2 nurses in here to verify that this is the correct blood transfusion, the correct drug, right person. And then we'll go ahead and get it set up. Your most recent vital signs, when I took them this morning, was 92 over 56. Your heart rate, when I took it, it was 147. Your respirations was 20. Your temperature was 99.2. And I did put oxygen on you just because your O2 is still sitting at 90. And I'm also going to call the doctor and let him know that you are having a slight temp of 99.2 before we give that transfusion, because we don't want to give you a transfusion and you already got some things going on. You're alert and oriented. So yes, we're going to give you that medication and make sure your call light is within reach and you're fine. Giving report off, we have Mr. Green, who is a 75-year-old man who fell at home getting up to the bathroom at night. So he was admitted for further testing due to his abnormal lab values. He does have hypertension, renal insufficiency, ETOH, and at this morning his vital signs were about 99.2 for his temp, 98 over 60. His heart rate was 150. His respirations were 22, and his O2 sat was 90 at room air. He was complaining that he was having some nausea and vomiting. So I went ahead and started him on some D. I had orders to start the D 1.5 normal saline, 150 milliliters per hour, and so that is what he's running on. He has his NG tube. I delegated to the LPN to put it on low suctioning, and we just been monitoring, so he's been doing pretty well with that. But as I was doing my assessment, I noticed that his GI was hypoactive. His breath sounds were clear. His vital signs that I took probably around, his latest vital signs I took was 92 over 56, 147. His respirations were 20, and his temp was 99.2. But his O2 was still sitting at 90, so I went ahead and placed oxygen on him just for precaution. He's having that nausea and vomiting and dry heaving, so I just want to make sure he's getting the appropriate oxygen. He has an order for him to have a typing cross for, well, we already sent down the blood for the typing cross. We're just waiting on the results so he can receive his 2 units of blood transfusion, and he's supposed to get it over 2 hours. So because his temp was 99.2, I question that because I don't want to give it to him, and he's running a fever. So whenever his typing cross comes back, I'm going to recheck his vital signs again just to see where his temperature is, and maybe we can get him some Tylenol or something like that to help bring his low grade temperature down. He is alert and oriented. He was able to state his name, date of birth. He knows where he is. He did have a reseal at his right forearm, but it was accidentally pulled out. So the IR placed a triple lumen central line, which is okay for medication administration and blood draws. He is also still MPO status. He is MPO status. So yes. Because he's unstable, I also want to call his doctor before I go, just to see if he needs to go to ICU or PCU. So give me 1 second, just to make sure, because I don't want to give you a report and then they come and just take them. Hello, Dr. Green. This is Mykasha from Step Down Unit Neuro. I have a patient here with me by the name of Mr. Green, the guy who fell and has the GI bleed, the one I called you about. So because he's unstable, he's in room 225. Because he's unstable, I was wondering, are we sending him to ICU or PCU? Okay, continue to monitor, and if he gets worse, give you a call back. Okay, thank you. So as of right now, we are monitoring him, waiting on his labs to come back. But once we start that transfusion, once we get to that point, you're gonna hold his IVF once transfusion is started, and then resume when the transfusion is complete. He is an AccuCheck every 6 hours, and if it's above 200, you're going to notify the MD. Like I said, I held his heparin because he is a GI bleed patient. I questioned his Lasix because his blood pressure is low, and we don't want to make it lower than what it is. His blood pressure medication I held as well, just because he's like running that borderline, and I think that's a little too low. So I verified with the doctor and let him know that I did hold that med. So we're still, like I said, waiting on his CBC. I would possibly get an x-ray just to make sure that his NG tube is in the right place because of the nausea and vomiting. And we're going to take his vital signs. Like I said, with his blood transfusion, first 5 minutes. We're going to stay with them. Then every 15 minutes, we're going to keep rechecking his vital signs. And if he does not improve, please call Dr. Get Well again for an update whether we're going to send him to ICU or PICU. Yeah, and that's a complete of what I would do for this patient. Okay. Bed is lowered, head is raised. Checking his suction is on low. O2's on. He's receiving his he is receiving his fluids. He had a call light within reach. Bed is in the lowest position. And I think that is it.